Construction of the Roxborough Hospital continues apace, and with its progress, the Division of Health, Wellness and Family Development and the Tobago Regional Health Authority are keeping residents up to date on the hospital works. During the most recent stakeholder meeting, residents learned that preparations are being made to procure equipment for the facility. This will allow the finished building to be commissioned without delays.
The work has been done by professional groups to ensure that we identify those equipment that are necessary and that those that will be made available when the hospital is to the point of loading. So that much work has been going on as the building is being built to ensure that we do not have a facility that's standing there and not equipped.
The 22-bed hospital will feature primary care services and dialysis services, as well as an ambulance service. The hyperbaric unit will be relocated to the new facility. A helipad and a healing garden are also a part of the hospital's design. Residents got the chance to express their concerns and ask questions. One issue raised was the possibility of flooding occurring at the site.
One of my main concern was the controlling of the river from the top. It's not just around the runoff, around the hospital, from the top of the river.
From an engineering point of view, you would cater for a flood that will be happening in 1 in 50 years, 1 in 100 years. So all of these factors have been taken into consideration for the design to ensure that we don't have any adversities when it comes to water and flooding, etc.
With the future in mind, another resident asked about the potential for expanding the hospital as the population increases.
I understand according to the statistic report, there is a 2.1% growth in the east part of Tobago. Is your survey on the hospital done as for expansion based on the growth rate in East Tobago?
The third floor, I think.
Second floor,
right,
yeah.
Right, good. We've taken that into consideration. So the design has or will cater for another floor. So you'll see how it is designed when this is done. Well, I don't know if you could have seen it there, but that has already been taken into account.
Udicott is the project manager for the construction of Roxborough's secondary healthcare facility. The hospital is expected to be completed by October of this year. I'm Omodara Mills for Let's Talk Tobago.